Hello again. The Human Sciences Research Council is appealing to all South Africans to continue their participation in the 6th South African HIV Prevalence, Incidence, Behaviour and Communication Survey. With the occurrence of the COVID-19 pandemic, the HIV epidemic for many has taken a backseat. The survey is conducted to better understand the factors driving HIV in South Africa and to inform public health policies and progress. Let's discuss the progress so far, what they are seeing with Professor Khangelani Zuma, a principal investigator of this project, joining us now virtually from Pretoria. Prof, good afternoon, and thank you very much for your time. I understand from reading the press release that this is done at regular intervals, and it started in 2001, having been first commissioned by the late President Nelson Rolihlahla Mandela. So at what number are we of this survey? Can we just begin there, and when have you started it?
Good afternoon, Bradan, and thank you very much for the opportunity, and good afternoon to your viewers. This is a study, as you've just indicated, that we started conducting since 2001. And as you've mentioned, it was pioneered by our former president, Dr. Nelson Mandela. So this study, we've conducted it at the time when the country was facing challenges when it comes to HIV and AIDS issues, where we could not even contemplate that one day we'll be talking about people living a healthy life, even living with HIV. So we conduct the study roughly after 3 years. So the first one was conducted in 2002. The next one was conducted in 2005, and we call it SEPSAM-2. The next one was conducted 2008, which was SEPSAM-3, SEPSAM-4 in 2012, SEPSAM-5 in 2017. And right now we are actually on our SEPSAM-6, which is a 20th anniversary of this very large survey that has been going on in our community and expanding every phase of the study. It gets bigger.
So this is number 6, but you've issued a special appeal to South Africans to continue their participation. What are your concerns?
The participation is not going as fast as we would have loved. We are actually at about 45% in terms of our coverage. We are very grateful to those that have already participated. However, we do encounter challenges in some of the areas, especially in gated communities, communities with a high wall, and also in farming communities. We encounter some difficulties there, and therefore we are appealing to everyone that is approached by our identifiable data collectors, very professional people who go out to household, observing all the, for example, the requirements that they need to take care of in terms of other communicable diseases that we are facing, such as COVID-19, for example. So these are trained data collectors that we send to the field to encourage our people to participate.
Yeah, I understand you are targeting a total of 93,000 participants from some 25,000 households across all 9 provinces. Of that 45% or plus that you say you are at now, which of the provinces are far behind?
I think provinces such as Mpumalanga, as well as Western Cape, we're still behind in those areas, and also in Limpopo, we're still behind in those areas. So we are encouraging, in fact, almost every community or in every province, we have not reached 100% that we actually would like to see. So even though other areas are far ahead than others, but we still want even those households that have not yet been visited to actually open their gates when our data collectors come to their households. So we're appealing to all people living in the country, in all corners of the country, to participate in this survey.
Now, your timing, I understand, is you're going to continue throughout this year. We are in July, so you've got another 6 months or just less than 6 months runway still to go. Can you just share with our viewers then to set them at ease to understand what does this survey actually involve? And remember, many of them recently, their doors were being solicited as well under the census. The country has just done a census. Now you are coming to their homes now, but you are targeting a smaller number of people in terms of the geography of the country. But what does this survey involve? If they knock on my door, what are they going to be asking of me?
Okay. We need to understand that this study has contributed a lot into understanding the HIV dynamics in the country. I think we are where we can live happily, even living with HIV, is because partly of the information that we have been collecting as a country to understand the dynamics of HIV. So our data collectors, when they come to a household, they will ask you to participate in the study. We've got a household questionnaire where we collect information about the household situation, and we list people that are living in the household. We don't take any identifiers, no names, and we don't take any information that would identify you as an individual. And then once we've listed the people living in the household, we invite members of the household to complete a questionnaire in a private space whereby no other person would hear the questions that are asked, where we ask questions among young ones about their well-being, how are they taken care of, and then also among the older people who also ask detailed information about sexual behavior. Once we are done with the questionnaire part, then we invite people to provide a specimen or blood specimen that we use to test, for example, for HIV status. And to do that, we've got our counselors who are there as part of the team to provide pre- and post-test counseling. We actually also, those that want to know their results, we provide them the results. So this is also a service to the community. About over and above knowing one's HIV status, information that we collect other information that would help us understand the numbers of people in the country that are actually on ARVs, and also for us to analyze information about, for example, the viral load, so that we can know whether people that are taking antiretrovirals are indeed complying, and the antiretrovirals are actually helping in keeping the virus undetectable. So it's more than just research, but it's also a service to the community.
And this is done confidentially, and the information gathered is secured, and it won't be published, that who and who gave me this. You guarantee that?
It is guaranteed. Our information is published by way of reports. Since we're doing SIPSAM 6 now, we already have 5 reports that have been published previously. We only summarize statistical data that is published. But there is also no way, even myself as a principal investigator, I would not know that Kangelani participated in this study. But what we have is information that is collected without any identifiers, no address, no information that is provided or that is collected and published in any other way. That
Prof,
is not done.
Thank you very much for your time and clarifications and explanations. I'm pretty sure we'll touch base with you later on in the year. After all, the 1st of December is marked as World AIDS Day. There'll be a lot of focus around that time of the year. I'm sure by then you will have done more progress. We'll touch base with you later on. We wish you well. Thank you very much. Professor Kangelani Zuma, the overall principal investigator of the 6th South African HIV prevalence survey that's currently underway throughout the year.